Let's talk about some common complications of primary sclerosing cholangitis. Uh, this is a very important slide, and I want you to pay attention to it. These are the various types of disorders that we fear, and because of this, we start having certain aggressive therapy in these patients. The common complications are cholestasis. Because of the obstruction to the bile flow, there will be obstruction to the cholesterol and similarly bile flow. That will lead to stasis of the bile. Whenever there is stasis of the bile, it leads to basically inflammation, it can lead to infection, it can lead to cholangitis, and it can also lead to the development of bile stones. So the common bile stones are very common in these patients with primary sclerosing cholangitis. It can also present with cholestasis as well. And similarly, because of this cholestasis, we are going to have the symptoms like the pruritus and jaundice in these patients. If the bile stasis is there for a very long time, and there is repeated injury to the cholangiocytes, then the cholangiocytes are very prone to develop malignancy or the cholangiocarcinoma. So cholangiocarcinoma is one of the very feared complications in these patients. Along with that, an increased incidence of cholangiocarcinoma, these patients also have an increased incidence of gallbladder cancer. So these two cancer associations are very important to keep in mind when we talk about the complications. And one important thing is to do serial measurements or the serial radiography to look for these complications, even if the patient has been symptom free for a long time, because these can develop in an asymptomatic patient as well. One other important thing to discuss is the increased incidence of colonic neoplasia. When we started talking about primary sclerosing cholangitis, specifically in the section with the associated diseases, we said that the primary principal association of this disease is with IBD or inflammatory bowel disease, more commonly ulcerative colitis than the Crohn's disease. And in the patients who present with ulcerative colitis along with primary sclerosing cholangitis, they have an increased incidence of colonic neoplasia or primary colon cancer as compared to someone who has only ulcerative colitis without the liver pathology. So patients with primary sclerosing cholangitis who have ulcerative colitis, they should also be very serially screened for the colon cancer with the help of colonoscopy or various tumor markers if they develop the colonic neoplasia. So I want you to keep this neoplastic association in your mind as well when we talk about PSC. Similarly, if the patient develops long-standing disease and develops signs and symptoms of cirrhosis, then these patients are also very prone to develop portal hypertension, ascites, bleeding varices. So the peristomal varices like the bleeding esophageal varices can be there, periumbilical varices can be there, and anorectal varices can also be present. These were the common complications of this disorder, and our treatment majorly focuses on getting either number one, to avoid the development of these complications, and if any of these complications develop, then we work on preventing the progression of this disease. For example, if someone develops cholangiocarcinoma, then it is very important to do serial screening to look for the development or to prevent the metastasis of the disease or to prevent the progression of the disease in a very quick time frame.